All right, what's up, everybody? Welcome back to the referee room. It is Wednesday. We are doing lunch here. I hope you guys have your peanut butter and jelly sandwich ready to go. We got a very special guest in the house today. Last night, we did our Level 3 referee seminar, so a big thank you to Jack Raslowski, who put that together. He did a great job. Lots of great situational stuff. We'll talk about his amazing golf outing that he's got coming up on October 16th, so lots to cover today. Of course, I'm joined by Brad and our special guest, Matt. But first, oh yeah, the ref room, and welcome. We are joined by Brad, and of course our very special guest today is Dr. Matt Valente. Matt has a major hockey background. He played growing up in Michigan and here in Chicago. One of the nicest guys that I've played hockey with, great captain. I think we played on 3 or 4 teams together over the years, and we're going to be covering a lot on injuries and all kinds of stuff today, how you can look for injuries, what to look for, how to hopefully avoid players getting injured, things of that nature. I know Brad's got a lot of questions for him, and so first I'd like to say hello to Brad. Hope you had a great week. Did you check out our seminar last night at all?
I did. I didn't pop in officially, but our affiliate does a good job of making sure that we know that seminars are going on. So I know that they're keeping an eye on us as usual, just like they are the coaches. The coaches had some seminars last night as well. So everything's starting to progress. And the good thing is USA Hockey's issuing rosters. So is our local affiliate, and so are several other areas. So I think we're on the right track. We're moving forward. Michigan got the okay to play.
Really?
So they're going to go back to hockey.
When did that happen?
Sometime last week, I believe.
Wow, nice.
Their affiliate came out and said that they can start back to some play. So they're moving out of there, and we're moving out. So I think we're moving in the positive. Just so everybody knows, I know that USA Hockey and all the affiliates are working with local governments. They're, I would say, begging, pleading, kicking, screaming, however you want to put it, in order to try and get us back out on the ice and make us less of a risk factor, because we are covered majorly compared to a lot of the sports that are allowed to play. So that's just one thing I wanted to put everybody out there. I know that a lot of people are frustrated, and I understand that. Scott, I know you're one of them. But I know that there's lots of people, there's lots of very dedicated people to the sport that want to see our kids play. They want to see the adults play. They want to see the referees back out on the ice and get our great game going and make sure that our rinks are going to be here, because hockey has been on the climb for the past decade, and I don't think anybody wants to see that going backwards.
Well, Brett just had put a comment in, Brett Staley. He said that Michigan is back officially today, so that's awesome.
Thank you, Brett.
I was not aware of that. I mean, I know Michigan was shut down, Illinois. I heard that Massachusetts was shut down. I don't know if that's the case, but I thought we'd bring an expert on today. Matt is a very talented doctor. Not only that, you've seen him probably on TV, whether you know it or not. He did many episodes of the TLC reality show of ER Doctor. So why don't you explain that to us, Matt, and then give us a little background. I know you take care of a lot of different hospitals. You're a talented guy and a great guy, and you've always been a super guy to play hockey with, because this guy has gone above and beyond for any of the players on his team whenever there's been a injury situation, and I mean, even getting stitched up, he's always taken care of everybody. So I'm very happy to have you here with us today, Dr. Matt Valente.
Thanks, Scott. Thanks, Brad. Thanks for having me on the show. So a little bit of background about me. You know, I grew up in the Detroit area playing hockey. I played AAA growing up through high school, midget major, and then I went to college at the University of Michigan, and went on to medical school at Wake Forest in North Carolina, and then came to Chicago for my residency in emergency medicine at the University of Chicago. Met Scott maybe 10 years ago or so, maybe even more.
Probably
playing
a little bit
adult
longer
hockey.
than that. Yeah.
Recruited him onto my team, and
Right.
Had many years, many teams together. Johnny's was a lot of fun, and I practice at emergency medicine at numerous hospitals throughout Illinois and Wisconsin. I'm actually on staff at about 15 hospitals right now, but I predominantly work in at Advocate Condell Medical Center that's in Libertyville and Lake County. And then I work at a few rural hospitals kind of outside Chicago, Illinois as well, and sometimes in Wisconsin to help out when there's staffing shortages. So, a portion of obviously what we do in the emergency department is seeing traumatic injuries and sports-related injuries too. So I'm happy to answer some questions and talk a little bit about some of the injuries that occur commonly on the ice that you guys might come and encounter on players, and also refs when they take injuries as well. Yeah. So
I know that one all too well. Well, I'll tell you what, you've got a great background, and we're going to talk about a lot of these injuries. But I got to ask the first questions, and the first question is, when do you think we might be able to go back to hockey in Illinois?
Yeah, so that's a good question, and I think as with a lot of things, when people ask, when are we going back to normal, or when are we going back to work or school, it's kind of a loaded question, because what is going to be normal and when are we going to get there? So I guess if you're going to speak to, or when are we going to go back to the situation that we were before COVID came around in March, it's probably going to be quite some time. I think that these restrictions and the social distancing and other mechanisms that we put in place to prevent the spread of COVID is going to exist for some time, and we're probably talking longer than a year. The reality, I think, is that even when a vaccine becomes available, and I'm not completely optimistic that anything is going to become available, by the end of 2020, and if it does, which would be great, I think the manufacturing, distribution, and implementation of that vaccine to come down to the mainstream, population is going to be delayed. So even if something came out this fall, it's going to probably preferentially administered to healthcare workers and essential workers, the elderly, military, et cetera. And it's probably not going to come down to the people that are, healthy, young, and playing hockey. So I think that's probably going to speak true for most sports.
Yeah.
Doctor, I have a question for you. So if the essential workers, such as our healthcare professionals and then military and all that stuff, and the elderly, of course, are our most vulnerable society, once they start getting vaccinated, would you expect to see possibly at least a little bit of what am I looking for here? A pullback on the restrictions? Because now at that point, you have the people that are out there every day and that are exposed to it. They're going to be therefore vaccinated, which we know isn't 100%, but it's much less likely that they're going to spread it. Do you see any restrictions possibly backing up and letting life go back to a little bit more normal when that starts happening, though?
Yeah, I do. I think you're right. I think that all these little things that we do to implement the prevention of spreads, and the vaccine is a big part of that. I think we're going to see numbers, the infection rate go down, the transmission rate go down. And as that occurs, I think that, these guidelines will be loosened up. And so I do think that that's going to play a big role. I just think it's going to be, some time before we get back to, no masks, cramming 20 guys in a locker room and, not having other types of restrictions. But I think every little bit helps. And I think we're moving towards that. I think, the vast majority of people are kind of in alignment trying to work towards that common goal to get back to, normalcy.
Well, one of the things that, you and I had a conversation, Matt, when this was early starting, even before we had the lockdown and everything else. And I know that you had mentioned that, you thought we would end up probably locking down at some point, which we did. And then you thought we would come out of it, we would go back to hockey, but you didn't think we would make it through the coming season. So you thought we'd at least get a start. Well, we haven't gotten a start yet, but we had like 6 weeks of hockey before they closed us down. So with that being said, do you see us going back this year, or do you think we really probably have to wait until we have a vaccine? Are we locked down really for the full year or not?
Yeah, this is probably going to be, somewhat state and region dependent, how different types of government organizations decide to handle it. But I think like we talked about before, I think, going back to 5-on-5 in certain areas, especially as the, infection rate ticks up probably this fall and winter, places that do have, hockey right now, they should expect that if things become dicey and hairy and there's a lot of infections, and that it'll get shut down and other places may not start. So, if I could predict the future, I wouldn't be here sitting in Chicago, Illinois. I'd be in Vegas.
Right. Well, here's another question that a lot of people have asked. I mean, right now they're allowing basketball to be played, and it's considered a less risky sport than hockey. What's your take on that as a doctor?
Man, that really irritates you. I know, Scott.
It does.
But it's interesting. We spoke about this a few days ago, and I pulled up, the Illinois Department of Public Health's chart, kind of categorizing all these sports into 3 different categories: higher risk, medium risk, lower risk, and seeing how they were kind of organized. And it's definitely interesting to me. I don't know how they developed this, who developed this. I don't know that this has a great scientific basis. I think it's probably somebody's gestalt and, kind of where they want to throw something in a box a little bit haphazardly. I think the reality is the higher the close personal contact you are with somebody, right, the higher risk you're going to be. So I'm not really sure why basketball is, in the medium risk category. I know that's one that you pointed out before.
Yeah, just bare
in the high risk category.
A lot of guys taking their shirts off, sweating outside. They've got hands up against each other. They're touching the same ball that they're touching. Everybody, where hockey, everybody's covered from head to toe, with the exception, and they could even still cover it more if they get one of these full face shields that they could have. They'd have like only a breathing area. Put a mask on, you'd be like in a condom, basically. You'd be totally closed in. There'd be no way you could escape anything. So I don't know. I just think it's crazy personally. I mean, I know they got to draw the line somewhere, but so, I'm going to take it that they drew the line on hockey and basketball, and I don't agree with it. So I think everybody knows that.
This chart, basketball seems to be kind of an outlier from a high level. Seems like it'd be a high risk sport. So, either way, I think you splice it, like I said, if you're in close personal contact with somebody, you're breathing on them. I think the issue with hockey isn't necessarily so much when you're on the ice, it's on the bench and in the locker room. But that's a similar type of contact that you'd see in basketball, on the bench or, actually on the basketball court itself, even more so.
All right, next question for you. Oh, go ahead, Brad.
Real quick, Scott. Doctor, there was an idea floated by one of our past guests that possibly hockey was put into that higher risk category because it draws from a larger base of the metropolitan areas, to whereas basketball is more localized. So if there was an outbreak, they could keep it a little bit more contained. Do you think maybe they had anything to do with that? Or do you think it is, like you said, possibly just somebody putting it in a box somewhere and maybe doesn't have all the information?
Yeah. I don't really know how it came about. The only thing I could maybe think about is, somebody who was putting these in a box really likes basketball, and, they were thinking about, which sports they wanted to actually, kind of see continue on maybe this fall with high expectations. And, basketball, they were like, maybe I can squeeze this into the medium box. Maybe we can have a basketball season. My kids can get out and
So they had a better lobbyist, is what you're saying.
So.
All right. Next question I have for you, Matt. So, we've got the flu vaccine, which has just come out. Do you take the flu? Do you take flu vaccine, or does your family take the flu vaccine?
Yeah, every year. Yeah, as a healthcare provider, pretty much, 99% of us are getting the vaccine unless there's some reason why we kind of have opted out of it for a specific reason.
And now I see that AstraZeneca, I think today, announced that they had an issue with one of the people that was in the trial. And so I don't know if they've shut down their full operation with regards to trying to create this vaccine, but they have to go back and look at all the data and everything so that everybody is safe. But are you going to be comfortable taking that vaccine when it's released?
The COVID-19 vaccine?
Yeah, the COVID-19 vaccine.
Yeah, I think we'll have to see, what details are out there regarding what vaccine ends up coming to market and becoming available. As with anything else, I've got confidence in our healthcare system and, all the companies that are trying to develop one. Overall, vaccines are remarkably safe.
Yep.
I've told numerous people, when we talk just generically about, how healthcare has changed over the last 100 years, particularly in regards to infections, there's been 2 things in the last 100 years that have really changed healthcare more than anything else, actually ever. And those two things are, the invention and implementation of antibiotics, and then vaccines. They both occurred in the 1900s, and they've still saved, millions, literally, millions, tens of millions of people, annually. Vaccines in the United States are remarkably safe. The question I think that's really going to come around when the vaccine becomes available is how effective is this vaccine going to be? We're accustomed to vaccines that are 100% effective. You get the measles vaccine, and you don't have to worry about getting measles. You get the whatever vaccine it is, and we're just used to that. The outlier really is influenza, because after every year we have to come up with a new one because of the way influenza has different strains and tends to kind of realign and mutate every year. So with COVID-19, because we have no real experience with it, we'll have to see. Maybe it'll only be 50% effective, and it's only 50% effective. Then how does that really change people's level of comfort if they're at risk for having serious complications? Parents, grandparents that are in their 70s and 80s. Are they going to change their behavior knowing that they have a 1 in 2 chance of having protection? Maybe only time will tell how effective this first vaccine is. But it sounds like most people who are knowledgeable about it feel that it may only be 50 to 70% effective, which isn't great.
Right. Well, I mean, it would be enough to probably get us back to some kind of normality, at least doing things. But yeah, you're absolutely right. I mean, it's not an end-all, be-all cure for sure. Now, do you think that, with the flu season coming, I mean, what do you think we're in for in the future? And I know you don't have your crystal ball or you'd go to Vegas, but seriously, do you think we're going to be looking at another lockdown potentially as we get into, what is flu season? I mean, flu season is what, like November or December probably, with the worst months being December, January, February? What, fill us in on that.
It's a little bit variable. Sometimes we have flu season that starts up pretty early in the fall, but typically, yeah. I mean, we're looking at the winter months, December, January, February. Sometimes it gets a little bit of a late start, and we see it going, deep into the spring. And we've had years where influenza continues to circulate, even through the summer. Yeah. That happened a few years ago, where just kind of, it slowed down a little bit, almost like COVID, right now, where it continued to circulate, and then it just, came right back in the fall, winter. But I think the big complicating thing that's going to occur this fall and winter is that, right now, because we have limited testing, particularly rapid testing for the community, work environments, schools, sports, they're having people, and rightfully so, self-isolate and have people in contact quarantine just based on symptoms until those people can be tested. And that really is a logistical nightmare. So, everybody that shows up to school, if any child has a runny nose, cough, fever, whereas pre-COVID, it's no big deal. You just sent them home. You didn't worry about, sending everybody in that classroom home. Right. You didn't have to worry about sending everybody on the school bus home just because somebody showed up with a cough. So this fall and winter, even if COVID doesn't spike to really, serious numbers, we're going to see that all these other colds circulate in the fall and winter, and all these people with symptoms are going to shut down businesses, schools, sports, etc., out of precautions. But I do think that COVID is going to circulate much more intensely this fall and winter. And I expect to also see an uptick of all the other upper respiratory infections and colds that we usually see.
Well, I saw something on the news, I'm going to say 3 or 4 weeks ago, and they were saying down south that normally the doctor's offices do start to see colds and things of that nature throughout the summer season in the south, but they were saying they're really not seeing anything coming through the door like they did before, where they might see 1 case a week now because people have, they're washing their hands, they're wearing their mask, whatever the case may be, and it's really taken a lot of the other problems that we've had over the course of time away. Is that accurate here in Chicago too? Are you seeing less cases?
True. I have never in my career seen so few upper respiratory infections, colds, and kids with fevers in the emergency department as I did for the vast majority of of this spring and early summer. And I probably never will again. And it's because of social distancing. It's because kids aren't going to daycare. They're not in school. They're not in camps. We're not going to, crowded bars. We're not going to sporting events. So, the fact that we're not interacting means we don't spread these germs and viruses so that everybody continues to pass them around. And hopefully that pays us dividends this fall. But the problem is we just have a lack of testing. And so we know that all these viruses are going to spike, and it's going to cause closures. So I think, I guess the short answer is I think we should definitely expect that a lot of these businesses, schools, sports, are going to be having increased progressive closures as we move into the fall winter. And if things get really bad, particularly with COVID, then we may see another, partial lockdown.
Well, there you have it, everybody.
Well, I can, as a parent, I can tell you, when kids go back to school every year, like clockwork, expect to have something come through the house and it's just because you have a lot of kids. I have, 8-year-olds, and you love them to death, and you try to teach them everything, and you don't pick your nose and don't sneeze in your arm and wipe it everywhere, and they listen to an extent, but once they get out in that big group setting, it's no longer cool to go wash your hands after you sneezed at them. So it's unfortunate, but I think that's a big thing that is helping out right now with the other parts of it. So just my opinion, but
all right. Well, I don't want to, change the subject here, but we did bring Matt on to talk about some injuries and concussions and all kinds of good stuff like that. So I appreciate all your expertise on that topic. And that has been a pain point for many of us because we do want to get back to hockey, which everybody knows. But, a couple of things that we wanted to talk about today were like looking at injuries and potential and what we can do. I mean, we are trained when a player is injured to not ever, touch that player. But, we are also tasked with the responsibility, and we talked a lot about this last night during our referee seminar. For those of you who don't know what a referee seminar is, we always have to go to training each year and go through the rules and make sure that we're in touch with everything that's going on. So this year it's been new because we've been doing a virtual seminar. But we did talk last night and touched on, situations, because a lot of times if we are in the process of making a call from an injury, we don't know the seriousness of that injury. If that player is fully injured, is he going out the player bench door, or is he going out the stands door? So, we're tasked with having to assess the penalty appropriately, whether that be, a 2-minute penalty or maybe a 5-minute penalty or maybe a match penalty. We don't know. But maybe you give us some tips and things to look for. And I know Brad's got a lot of questions on this subject, so I'm going to kind of defer to him on this and get your list out, Brad. Here you go.
The big one is that I want to bring up, because especially because you're in trauma, the one that I think is the most important right now and is on everybody's mind is head contact. And, head contact can come in a bunch of various forms, but I think a lot of people don't realize the severity of head contact, Doctor. What exactly, how much force does it take? I mean, it can be an estimate or, I guess an opinion, but how much force does it take to actually cause a good head trauma to a person, or does it vary from person to person?
Yeah, that's a good question. I don't know any specific numbers regarding the amount of force. We really use more of the clinical symptoms after somebody suffers a head injury to dictate the severity of it, and then to determine whether, they fall in a category that's really high risk and needs brain imaging. But you're right that, this is really a big topic in an area of concern and evolution for all contact sports. In hockey's, this is a big deal in hockey. We look at high school sports in general, 15% of all injuries in high school sports are comprised of various forms of head injuries and concussions. So it's a big deal, and it's something that you guys are going to, deal with, on a regular basis. So I do agree that, sorting out if somebody's had a significant head injury and if they've had a concussion, being able to to be helpful in guiding that person and make sure that they seek medical attention when necessary is really important. Basically, people use the term concussion a lot, and really what a concussion is, it's somebody who's suffered a head injury, and it's not defined by the amount of force. It's again defined by the symptoms that they occur after a head injury. And a concussion really is somebody who has had some degree of altered mental status or an altered level of their consciousness. So that can go from the most severe form, which is a loss of consciousness, where they're completely unresponsive for, whether it's a few seconds or whether it extends over a minute, which is quite a dramatic event, to people that they didn't lose consciousness. They hit their head and then they're just not quite acting right. You might notice them as a player who is not answering questions appropriately. Maybe they're laughing inappropriately, or they kind of have a blank stare on their face. That falls into the same category of an altered level of awareness or consciousness. That is a concussion.
How long does that take to go away? I mean, when you see somebody that's not responding properly, maybe you think maybe a little bit dingy or something like that. How long does that sort of a symptom last? And does it go away over time? Or is this something that, is going to affect them for a longer period?
Sure. And so, the brief episode where people have an altered mental status or an altered consciousness, a lot of times that only lasts for maybe 30 seconds, a minute, a few minutes, and it resolves. And I think that's the tricky thing, is sometimes during the event when the player may be on the ice, they may be kind of a little confused, and nobody really appreciates it in that brief period of time where it's occurring. And then the player gets up, the player is acting normally, he maybe gets back out on the ice, and then later on he continues to have other symptoms for the next few days. So a lot of times post-concussive symptoms last for a few days, and they can last as long as 2 to 4 weeks after. And those symptoms are, headaches, problems with memory or concentration. Sometimes people feel a little bit dizzy or have some balance issues. And, one of the big things with people that have any of these concussion type symptoms is, they need to stay out of contact sports until all their symptoms have resolved.
So what is the procedure that you recommend if you have, not from us, but if a parent has a child that's injured on the ice? I mean, obviously they should take them to the emergency room and get them checked out. But, what is like the full procedure here, and what are they going to expect when they get there?
Yeah. So I think the first thing is recognizing if they have a really serious head injury. So anybody who's confused, anybody who is unconscious for any period of time, anybody who's acting inappropriately, that person should be removed from the ice, and they really shouldn't return until they've sought medical attention. As far as other symptoms, without that, if somebody has a mild headache or some nausea or some dizziness, without any type of problems with their cognition, that person could probably return if they feel comfortable and they're acting appropriately, etc. Escalation of symptoms or worsening symptoms, that's another issue where they're going to have to probably discuss it with either if there's a trainer on the ice or seek medical professional if they have worsening symptoms that don't seem to be improving, even if they're minor.
I mean, I remember there was a tournament, probably not this past season, the season before this. There was a girl from Canada here playing boys hockey. I think it was a Bantam game. And the girl, she just lost her footing. Literally, wasn't anybody's fault. She lost her footing and she went sliding in. And I think she hit her head right into some guy's knee. And she was out. I mean, she was sound asleep on the ice. And, got her back up. They got her off. I had the same team an hour and a half later. There was one more game before they played again, and this girl was back out on the ice. And I went over to the coach. I'm like, seriously? You're letting this girl play? She was sound asleep on the ice, like snoring practically. I'd never seen anything like that before. And, the coach was like, oh, yeah, I'm just horrified. But, I mean, what's your thoughts on something like that? I mean, I think it's totally irresponsible to let that player come back in that situation.
Yeah, I mean, we've learned a lot over the last, 10, 20 years with head injuries and what it does long term, even if you don't have an actual bleed in your brain, and Players like that, there's a couple different issues. One, obviously we worry about a serious brain injury, which would be bleeding in the brain. So they should seek medical attention. Even if their symptoms return to normal and they feel better and, want to get back out on the ice or participate in sports, there's a couple other issues that are involved. And, one of those is, what's called a secondary impact syndrome. It's pretty rare, but it can occur, where somebody starts playing in a contact sport and has a second head injury after an initial concussion, and the brain swells very extensively, and it can actually lead to death. And that's one of the reasons why the guidelines, have changed, over the course of the last 10, 20 years to recommend that people should not return to sports until all their post-concussive symptoms have completely resolved, and even resolved when they're provoked. In other words, when they're doing exercise, because sometimes people's symptoms will resolve. They won't have a headache or dizziness or concentration problems when they're going along their normal business. But if they start jogging or they get back out of the ice in a hockey practice, they start noticing they get headaches, they feel kind of dizzy. That person again shouldn't engage in any sports that could result in another head injury because of that concern. And we also know that, as anybody who suffers one concussion is more likely to have another concussion. And we also know that the effects of these concussions are cumulative. So, kind of like obtaining x-rays or CT scans, it's a very small amount of radiation if you just get one CT scan or one x-ray. But over the course of your life, if you get a CT scan every week, that's a lot of radiation, and that can have serious adverse effects. And the same is true of head injuries, which is one of the reasons why we know that boxing has really, boxing, football, and in hockey have led to people as they age, that cumulative effect of head injuries really causing some, severe brain problems in the future.
Hey, I don't know. I've never had this answered, so I thought I'd ask. Are head injuries worse for adolescents than they are for adults, like long-term wise? Adults, we tend to bounce back right away. And kids sometimes don't know the difference. If a child or one of your kids or whatever has a head injury, does that affect them later in life more than it would affect an adult that has a fully developed brain? I've never had anybody answer that before. I've never asked.
Yeah, and I don't know a specific answer to that.
Okay.
All I really can speak to is the fact that if you're a child and you're suffering, concussions repetitively, because it's cumulative, right? If you continue in adulthood having more concussions, the more you have, the more head injuries you have, the more likely you are to experience problems with, brain function as you become an adult. The more likely you may have early onset dementia or other problems with your memory in adulthood. So
I just never had that. It popped into my head right now, I won't lie. So I thought I'd ask.
So I'm curious, because I've never been in for a concussion, to the doctor, knock on wood, I guess. But, once you get there, what do you expect as the player coming in there? They're evaluated, obviously, but what are some of the tests that you guys do? And is there any medication that's given to the individual? How often do they have to come back? What's involved in this whole process?
Yeah. So typically when somebody presents to the emergency department after a head injury, the first things we're going to do is do a neurologic exam and, see if you're acting appropriately, see if you have any problems with your strength, sensation, your cognition. We're also going to be concerned of anybody who suffered a head injury about their neck as well. So immobilizing their neck if there is any confusion and we feel that they're unreliable to tell us if there's neck pain. And so that's an issue on the ice. If you've got a patient or a player that's unconscious on the ice, you also want to be very careful, like you said, about moving them in any way because there could be a neck injury as well. So in the emergency department, we evaluate their head and we evaluate their neck. And then depending on if they have severe symptoms, so loss of consciousness, severe headache, vomiting, or an abnormal neurologic exam, we'll take those patients and we'll usually get a CT scan of their head. So they get imaging to find out if they in fact have bleeding in their brain or a skull fracture. A concussion is really defined as somebody who has some alteration of their consciousness after a head injury, but has a normal CT scan. So they don't have any bleeding in their brain. They don't have a skull fracture. Once you have bleeding in your brain detected on a CT scan or a skull fracture, then now that's not a concussion. That's an intracranial hemorrhage, and that's a severe head injury.
Yeah. After you've gone through all this, and then you've taken your time off, and you're starting to be reduced symptoms, what's a good rehab plan for people in order to start getting back into physical activity? Because you don't want to go from 0 to 100, I'm sure, because that's not good for you in other ways as well. But what's a good way for players, referees to start gearing back up in order to see if those symptoms are going to be agitated when they do start fully exercising and working out?
Yeah, I think that the first thing is to just rest. You don't want to be engaged in any activity that's going to be exertional or strenuous. A lot of people that have a mild concussion, they may have symptoms for a couple of days, a little bit of dizziness, problems with concentration, some off and on headaches. But after a few days, they typically resolve. And, those people can get back to doing some exercising, and they should probably just start in a little bit of a stepwise fashion and, do some exercise first to see if they develop any symptoms. And if they develop symptoms, then they should not engage back in full contact activities. If they can exercise and exert themselves and get on the ice and practice and they have no symptoms and they're asymptomatic, then, they could resume activity.
Great advice. Thank you. Brad, what else you got for us?
Well, my next concern is the one that I think all hockey players worry about, because, we don't worry too much about our heads because we play hockey. But the big one is knee and ankle injuries. And, a lot of those are caused either by us misstepping, which does happen, and it's a contact sport. That's one thing. But the other way that they happen is when a player makes an overt movement with their knee and sticks it out, strikes an opponent in the knee, they catch him in the ankle at the same time, stuff like that. I just want to know, as players, what we can do to prevent that. And then as officials, what we should be looking for when players making overt movements in order to cause an injury to a player in the lower body region. I would
put your hand up.
Together.
That's what you got to do right there. I see a player stick that leg out. My hand is going up in the air. I don't care if he takes him out or not. He's going to the box. There is no room in hockey for that. I mean, you need to put those guys on the bench at that point. I hate to see that. And you do see defensemen that have been beaten. And what do? They stick a leg out. Well, I don't care if the guy missed you by 3 feet. My arm's going up in the air. So that's.
I agree with you 100%. It just from a doctor's standpoint, how dangerous are those plays?
Well, yeah, I mean, fortunately in hockey, lower extremity injuries are a small portion of the injuries that hockey players get. But you're right. I mean, those are can be serious injuries, particularly when you talk about knee injuries and people sticking a leg out. Fortunately, hockey players are well protected. The vast majority of injuries we see in the lower extremity are sprains, and they're what we call soft tissue. So they're actually broken bones. That's true of the knee, particularly, and also the ankle. The injuries that are much more common in hockey players, though, are actually shoulder injuries. By nature, hockey's kind of an upper body sport, especially with contact and body checking using the shoulder, and then the shoulder also impacting potentially the boards. But the best way to prevent, most of these injuries, especially if they're, knee or ankle sprains, is really stretching beforehand. That's really the best thing you can do. Make sure that your equipment's appropriate, the right size. You're not skimping on your equipment. You're not cutting parts of it out. Like, we know some players have had a habit of doing, dismantling their shoulder pads for better movement, things like that.
Yeah. Did you wear shoulder pads when we were playing, Matt?
I've got
a lot of guys in the men's league don't wear shoulder pads, but they should.
No shoulder pads, but I wore a full face shield.
Yeah, there you go.
Okay.
I'll tell you, the one thing I don't get, even in men's league, why they don't require a full cage. I mean, I'm sorry. I know a lot of guys. Some guys are out there with the shield. We won't mention any of the names, but at some point, we pretty much see those guys get opened up. And, the guys that are out there with nothing, I think they're absolutely crazy. There's nothing that's going to come from your professional men's league career, even if you got the the so-called $1 so you can play now legally. We talked about this a couple weeks ago. It was brought to our attention that some men's league may be paying their players $1 so that they will be professional and exempt from not being able to play right now. So if you're one of those...
I have not heard of that moving forward.
I haven't,
Scott,
but I sure like the idea. Just think, everybody would be a professional player at that point. They'd have their contract. They could put it up on the wall.
Maybe the American Dental Association is lobbying really hard. You know?
I bet they are.
They're staying in business with all the hockey injuries, broken teeth.
Exactly. Well, that brings me to a point. I know you're not a dentist, but we do see guys that get more in the men's league with an injury to the teeth. Amateur hockey, not as much with the youth because they do have the cage on. They've got the mouth guard, and I know they all wear their mouth guard religiously. So, but besides that, what is some advice that you would give to let's say a men's league player? I mean, I was playing one year. It was Thanksgiving Eve. We were at McFetrich. It's 11 o'clock or 11:30 at night, the night before Thanksgiving. We have one goalie, so they've got a shooter tutor out there. The shooter tutor was made out of plywood. Guy takes a shot, comes off the plywood, boom, right into the guy's mouth, pushed all his teeth in. Where are you going on Thanksgiving Eve to find a doctor when they're not only taking that night off, they're taking Thursday, Friday, Saturday, and Sunday off. You're not going back into that office on Monday. What do you do for a situation like that? I mean, what is your best option?
Yeah, so, teeth injuries are definitely a big problem with people wearing half face shields or no face shields whatsoever. One of the questions I get a lot, and, we see patients that have their teeth knocked out. And the question is, well, what do you do with that tooth? How do you salvage it? Can you salvage it? And the answer is yes, you can salvage that tooth, actually. So if somebody has their tooth that's completely knocked out, obviously our main concern is their head and their neck, like always. But in regards to the tooth itself, that tooth should be brought to the emergency department when they come in. And it should usually be transported either, and you can actually use milk, or you can actually put it in the person's mouth. And their own saliva will help protect some of the ligaments that are required to reestablish when it's reinserted. So typically, if I've got somebody who has their tooth knocked out, they come to the emergency department, they bring the tooth, I will reinsert it back in. And then I put what's called a copac, which is it's almost like a putty that hardens up to splint it until they can see the dentist. And there's a certain percentage, of those teeth that are salvageable, and they will reimplant.
Wow, I did not know that. That's great advice.
I just learned two things at once on that one. One, you could transport your tooth in your mouth. I knew the milk thing, but I was always like, where are you going to find milk in the middle of a hockey rink? Two, I did not know that you can basically bond it back on in order to get you over to a dentist. So I honestly, on Blackout Wednesday, they referred to it. I wouldn't have thought to have gone to the ER first. I would have looked for a dentist, and probably at that time, that tooth would have been not salvageable.
Yeah, that's when I've
actually had patients come into the emergency department, they knock their tooth out, at home, they come right in, then they don't bring their tooth. I'll send their family member back to go get the tooth, and bring it in. So
okay.
Yeah, that's great advice. That's something that we should all know because it's advice that we can pass on to somebody in a bad situation. It's amazing to me that we have so many great, talented professionals like yourself that play hockey. And I know I mentioned it on the show before. We had one of our players have a heart attack probably 6 or 7 years ago between periods. And I mean, he had passed. He was expired. But for the grace of God, we had a registered nurse that was up in the stands that went and got the paddles. And we had 7 or 8 doctors on the ice playing. And they went to work on the guy and saved him. And, we really do have a wonderful community of people in the hockey industry. And that's one of the points that I always make, that, right now the governor has us shut down from hockey, but there's so much more to hockey. The people that you meet, that you grow up with, that you become friends with, that you can turn to in a situation. And I know, Matt, I've called you before with a question, and not necessarily the middle of the night, but when I have had a medical question, I've turned to you, and it's great to have that relationship. That's something that a lot of people don't have in their life. And, it's not a case of you can afford that or whatever the case may be, but we have a relationship from hockey, and that's opened up doors, whether it be for medical, for an attorney, for an accountant, a teacher, a repairman, whatever the case may be. We just have such a great hockey community. And that's something that I feel like people are missing out on right now, because when they're not together, they're not playing hockey, they don't have that opportunity and benefit. So that's very special to me with the hockey community.
Yeah, I mean, as all of us know, playing hockey, the hockey community is really tight. We form some of the strongest bonds on the ice with guys. You're going into battle when you're on the ice with guys, and guys take it seriously. It doesn't matter if you're playing.
Yes, they do. They will
totally,
kill for that little glass beer mug. Okay.
Yeah. We all feel like we're in the show,
That's right.
So, you're right about that. It's also, you bring up a good point about, another player that went into cardiac arrest, and we hear these stories not infrequently where somebody collapses. And that's another thing that I don't know what type of training or preparation you guys as referees have for that. But that's really important to know how to handle that situation. And it really doesn't take a lot to be able to save somebody's life. And these aren't traumatic injuries, right? These are people that just all of a sudden collapse on the ice or on the bench. So if you see that, whether it's a fellow referee, whether it's a parent in the stands, whether it's a kid on the ice or the bench just collapsing like that, unresponsive, there's really a couple things that you can do, and you only need to do a few things, and you can save their life. The first thing is, if somebody collapses, everybody's adrenaline is going to be running. You're going to want to check to see if they're actually responsive at all, if they're breathing. People put too much stock in checking for somebody's pulse. Okay. And when you're amped up and you've been skating around the ice and you try and feel somebody's pulse, you're more likely to feel your own pulse than potentially that patient's pulse. So the bottom line is, if somebody collapses and is completely unresponsive on the ice, you should do three things. The first thing is you should start CPR. The second thing is somebody should grab an AED, which is one of the defibrillator pads that many rinks now stock so they can put it on the patient to see if that patient needs to be shocked. And the third thing is to call 911. No. People are also a little bit hesitant to start CPR, chest compressions on somebody. And really, we know that chest compressions early and adequately is one of the most life-saving interventions you can do on somebody that collapses. And there's really very little risk to doing chest compressions on somebody. One of two things is really going to happen, right? If you start doing chest compressions and that person is not unconscious, they're going to wake up. And that's a good thing.
Yeah.
The other thing that's going to happen is they're not going to wake up, and you're doing what needs to be done.
Well, that's great advice. And
bringing up the AED, I know there's a lot of people that they don't want to go get an AED and put it on. Can you explain that it's not you physically sitting there pushing a button for people? Because I think a lot of people that makes them nervous.
You broke up a little bit on me, Brad. Can you repeat that?
Yeah, so a lot of people get nervous when anybody brings up go get an AED. And they're nervous because they're there and, oh, God, do I have to use it and push the button? Can you run through on how an AED works? Because I have the training on it from where I work, and I just would like some other people, in case they don't know about it, just let them know how it works.
Yeah, sure. So an AED is a very simple device. It's meant for people that aren't medical professionals, and they're truly life-saving. So when somebody suddenly collapses out of nowhere, a lot of those patients, okay, maybe the majority of those patients have suffered a heart arrhythmia. So the electrical activity of the heart is now not working. And many of those people need to have an electric shock to restart their heart. And that's done by an AED. And so, yes, we do CPR so they can continue to get blood flow, but really how it works is you apply the pads to the patient, and there's instructions, very simple instructions on these AED devices, and you apply them to their chest wall. And all it does is it says either, and usually they actually talk and they say, shock indicated, or they say the shock is not indicated. If the shock's indicated, then you press the button and the person gets a jolt of electricity. And again, there is no risk in putting that on the patient and shocking the patient, because it will only detect if the patient has an abnormal heart rhythm that potentially is not compatible with life, and usually not compatible with life if they're unconscious. And even if they were conscious and you were to deliver a shock to a patient, it wouldn't hurt them.
So
thank you.
So you're basically eliminating the liability from anybody that's trying to step in and help. Is that correct?
So correct. So doing CPR number one, is not going to hurt somebody. Okay. Applying an AED and delivering a shock on somebody is also not going to hurt somebody. The amount of good you can do on somebody, who is unconscious in front of you by doing those two things is literally the difference between life and death.
Oh, that's great.
I appreciate that.
That is great information, and I hope everybody takes note of that, because you definitely could have this happen in a rink. Nobody thinks that it's going to happen, but you could be at a rat hockey, a men's league, whatever the case may be, even a youth hockey game, and this situation can come up. So I appreciate that.
And I'll add a third thing onto this, okay, because CPR guidelines have changed over the last 10 to 20 years as well. And a lot of us, who are older, who learned about CPR 10, 20 years ago, we all remember about the breathing component. And really, it's been essentially almost removed. There is really no good evidence, and this may come as a shock to a lot of people, there's no good evidence that breathing for somebody who's suffering a cardiac arrest is actually beneficial and actually increases their survival. So don't feel the need that if you start doing CPR on somebody that you have to breathe for them and do mouth to mouth. You actually don't. There is good evidence that by doing good chest compressions and pumping on somebody's chest, it actually, the whole act of pushing their lungs down in addition to their heart actually delivers some amount of oxygen into their lungs, and there is no need to breathe for that person by doing mouth to mouth.
So is there a number of thrusts that you're supposed to, do to a patient that's in that situation? And then, do you break like you did when you were breathing, you were pumping, and then you give them a breath, and then you go back to pumping, or do you just keep pumping?
Continuous. So we want to do it early and continuous, and breaks unless absolutely necessary. So when you're applying the AED, it's necessary. When you're delivering a shock, it's necessary because people need to step back from the AED machine. But other than that, you just want to do CPR. Typically, we want to do a rate of between 60 to 100 a minute, which means a little over 1 per second. But if you're doing chest compressions and you're grabbing the AED and you've called 911, you've done everything that you can do, and you've done 100% good job.
That's great advice. Thank you for that. I appreciate it. And I hope everybody else out there does too, because you never know when one of your friends is going to need that.
Mm-hmm. Or a complete stranger.
Yeah.
You never know.
That's right. Well, it's nice that somebody would have that training. And I think somebody did mention in one of the comments that it's a good idea to know if the rink you're working in has an AED device and where to find it. So thank you for that, Mudster66. All right. I don't know who Mudster66 is, but good comment.
No idea.
That's right. Okay. All right, Brad, we've got the breakaway. So let's do the little intro for Brad here for his breakaway. Let's put that up for a second, and let's bring Brad back. What are we doing today, Brad?
Well, I just want to cover, since we're doing some injury-related stuff, as referees, while we're out on the ice, we oversee all the players, coaches, and parents at the same time. Be aware of the players while you're out on the ice, not only for injuries that are caused by other players or possible falls or accidents. Be aware of medical conditions that can happen out on the ice. You can have diabetics out on the ice that don't even know it, and all of a sudden they're talking 100 words a minute. You got a goalie chirping guys, then all of a sudden they take a step, and then they take a step back and fall into the net, and they're like, you can tell that there's something wrong with them. If you see something like that, please don't be afraid to stop play. Make sure and check out that player, or if you have a player during a stoppage that you feel could possibly be injured or having a medical issue, please alert somebody from their coaching staff so that they can look at it. Coaches and parents and even other players, they're so into the game that sometimes they might miss something that's standing out in front of them. And I've been on the ice before where a player is unfortunately, had a diabetic episode, and they were standing in the net, and it was a goalie. And all of a sudden he turned gray, and he started stumbling forward, and I caught him, and we got him over to the bench because I stopped play right in the middle of it. And little did anybody know, there was a paramedic upstairs. She came down right away. They called 911. She stayed with him, and we found out from the coach a little bit later that his blood sugar had, shot up astronomically. They had no idea. And then I saw him a couple weeks later, and the child had type 2 diabetes, and nobody knew.
Wow.
So just be aware of everybody out on the ice, including your partners. I know we say that, keep an eye on your partners, but I was on the ice once and a puck went off the crossbar and hit me right in the face. I took my whistle hand, put it on my chin. Well, guess what? I can't really stop play with no whistle hand.
Yeah.
And unfortunately, my partner didn't see it for a little while until I skated all the way around the ice. And
Well, we say all the time, you've got to watch your partner as much as you're watching the game, and that's so true. Normally, you're saying that in a 3 and a 4 man. If you're the linesman, you're watching your partner. If you're a referee, you're watching your partner to see if he moves behind the net, and you have to change position. But in the 2 man, it's no different. If you see your partner getting taken out or getting a puck, you need to be aware. Give him a second. I get that, and you can wait it out for a second, but at some point, you need to shut play down. You need to give that person a break and some help because you just don't know what condition they're going to be in when they get up, if they get up.
Agreed.
So
that's the breakout today.
There you go. All right, that's Brad's breakaway. So good job on that. Matt, we're going to start wrapping things up. If there's any last-minute comments, don't forget we do the Ref Room every Wednesday. We're on at noon. We now have a custom URL. Thank you to all the subscribers on YouTube. It is youtube.com/C/RefRoom. So you can find us as Ref Room, as well as on Facebook and on Twitter. It's twitch.tv. I'm sorry, not Twitter. Twitch. Twitch.tv/RefRoom. So you can find us on Facebook, Ref Room, the group Facebook, the group's Ref Room on Facebook, and the page Ref Room. So we do this every Wednesday again at noon. I appreciate everybody joining us. Thank you for that. If you got any comments, we're going to give you the last chance. If you want to ask Matt a question or two, we'll give everybody a second to respond to that and see if they want to get something up here. If not, we've had a great run with the NHL the last week or so. We had 3 Game 7s. How about that? 1 going to overtime. Okay, let's see. We got a comment here from Brian. What's up, Brian? Good to see you. Let me bring that up for you guys so everybody can see it. He says, thank you, Dr. Valente, for sharing some awesome information. Yeah, we appreciate it, Matt. Thank you for taking time out of your day to do that. I know you're a busy guy, and you got a family and everything, and you've always been a very generous person with giving and time, and a great captain and a great leader out on the ice. So for that, I thank you. We don't get to play anymore together. We haven't even played any golf. You should come to the referee golf outing. We're going to be doing that. So
I was actually thinking about it.
I got to touch on that. Yeah, because we've got the referee golf outing coming up on the 16th. And I should have had a graphic today. I did the thing and I didn't bring it in here. I don't think this one. No, that's not the one. Sorry about that. That's definitely not the graphic that you want to see. But anyway, we've got a wonderful outing October 16th. It's at Bloomingdale Golf Club. And
Golf Club.
It's a really nice place if you haven't been there. They took great care of us. We did this back in August rather. Had a great time. It's a scramble format, so we have a 9 a.m. shotgun. I think the cost is $45. That includes golf and the cart. I believe the adult beverages were sponsored last time. We'll give them another plug from Reek Hockey Pants, Reek Hockey Equipment. Thank you to Reek that sponsored adult beverages afterwards. But it was just a great time. Great to get out. Great to see everybody. Have some hockey camaraderie because we all miss that right now. And again, Matt, thank you for joining us. Brad, you got anything before we go?
Yeah, just real quick with the golf outing. Scott posted it to the Ref Room. There is a URL for a Google Forms that if you want to register for the golf outing, it got put together so that it'll digitize all the information. You go in there, got to put your email in, you pick a team name, keep it PC. I've seen most of them already.
So you can't have one of the men's league names for your team?
No. There's quite a few men's league names already. But, and then you can put in, 1 golfer, 2 golfers, 3 golfers, 4 golfers. If you're hesitant about just registering by yourself, register, and then somebody will be in contact with you because there's probably going to be some people looking for a 4th. So
for sure,
referees are pretty welcoming when you referee with them in a different situation or a new game, right?
Yeah.
Golf is kind of the same thing, except for now you get to make fun of people afterwards if you golf better.
Yeah, and we do this show for players, coaches, of course referees, but parents. We're trying to include everybody in this show. So a lot of times when people walk into the rink after the weekend or on the weekend, and they've had that high school game and they've got some questions, or the squirt game, they run over and they find the referee as he's walking in, and they want to ask you, why did this get called this way, or what happened? That's what this show is for. So, tell your friends, tell your parent friends and coach friends to come join us, because it's an open forum and it's a chance to get a referee's viewpoint. And we've had coaches on the show. We're going to have more coaches on the show. I don't know that we've had any parents on the show, but I do call a few of them on the phone to find out what's going on. And, that's kind of what this is all about. So take advantage of everybody and, get your questions answered right here. We take lots of comments and things that we'll answer here through Facebook or through YouTube. So with that, thanks so much, Matt. Really appreciate it. It was great to see you. Brad, always a pleasure.
Good seeing you guys too.
All right, guys, that's going to kind of do it for us today. So thank you for joining us on the Ref Room. I am Scott Smokin' Sills with Brad Baumrock and our special guest, Dr. Matt Valente. Thanks, Matt. All right, everybody, have a great week. We'll see you next Wednesday. We do this at noon. Take care.